how are you today? Once again, this is Teacher Jude and welcome back for another informative video. So for today's video, we are going to continue our topic last time. So if you remember, last time we discussed about diseases. And if we are going to give the meaning of disease, a disease is an unhealthy feeling or thing that is happening in our body and our mind. It could give us pain, feeling bad, or death. So that is the meaning of disease. And also last time we discussed about viruses, we discussed bacteria, we discussed body breakdown, and the last one is genetic disorders. So these are the four factors or four reasons why human or a person acquired diseases. So last time also we had discussed hepatitis B. Okay, it's a type of disease. Hepatitis B. Hepatitis B is caused by virus. It could attack or it could affect our liver. So the primary organ that will be affected is our liver. So how are we going to acquire this hepatitis B? Okay, so how are we going to get? First is the blood. Second is the saliva or the body fluids. Okay, so those are the two ways how to transmit hepatitis B. Okay, and what happens to a person if he or she has hepatitis B? So what are the symptoms, the signs and symptoms? Number one, fever, meaning high body temperature. You're very hot. Number two, body weakness. So very weak, not enough energy to do things, to do our daily activities. Number three, lack of appetite, meaning she or he doesn't like to eat. Or yellow eyes, as well as yellow skin. So those are some signs and symptoms if a person having hepatitis B. So Teacher June, how are we going to prevent or how are we going to stop acquiring hepatitis B? So first thing is we should take care of ourselves. And another thing is very important is through what? Through vaccination. And what is the name of the vaccine? Hepatitis B vaccine. Okay? So once again, hepatitis B is caused by virus, hepatitis B virus, and it could be prevented by having vaccination. Alright? So, second, we have what we call tuberculosis, or in short, TB. TB is caused by a bacteria called Mycobacterium. Okay, Mycobacterium attack our lungs. So primary organ that will be affected is our lungs. So how are we going to acquire tuberculosis? Okay, tuberculosis usually transmitted through person to person, or if you are breathing in bacteria through the air. Okay, so next, what are the symptoms, or how do we know if a person is having tuberculosis? Number one, he or she is having cough or coughing prolonged. Number two, shortness of breath, or she is having difficulty of breathing. Number three, chest pain. Okay, and we have also fever. And the last one, we have weight loss. Okay, these are some symptoms of a person who is having tuberculosis. Okay, so how are we going to prevent? So number one is by having vaccination or the vaccine called BCG or Bacillus calmette-guerin vaccine. Okay. Next, we have also to visit our doctor regularly, have our lungs checked. Okay. Next, we have also to avoid contact, meaning do not go near people very close, people who are infected. And we should also stay in a ventilated areas. When I say ventilated areas, meaning open, okay, open areas. Okay, so those are the ways to prevent tuberculosis. So next disease is we have human immunodeficiency virus or HIV, acquired immunodeficiency syndrome, or what we call the AIDS for short. Okay, so HIV or AIDS. So HIV, of course, caused by virus. Okay, the HIV. It attacks body cells that fight infection. So normally, it will attack our immune system. It will attack our cells that protects our body. Okay, so primary target is our immune system. So if we are having an HIV virus, we are what? Prone to any diseases. So we usually acquire disease easily because why? Our immune system is very low. Okay? If left untreated, could lead to AIDS. So normally, student, if a person is having HIV and if she or he is going to ignore that virus, it could lead to AIDS, which is very dangerous. Okay? So, according to study, they believe that AIDS or that HIV is coming from West Central Africa. Okay, so that is the origin of HIV. Okay, so unfortunately, there is no cure or vaccine for AIDS. So if you are having AIDS or if you are having HIV, there is no vaccine. Okay, so 1 up to 3 years life expectancy. So if you are having AIDS, so you just only live 1 up to 3 years. So unfortunately, because there is no vaccine available. Okay, so however, we have what we call antiretroviral treatment, okay, or antiretroviral therapy. So this type of treatment, this is given to a person who is having HIV. So what happened here? These drugs, it could reduce the amount of virus in the body. It could also prevent the transmission of the virus. And it could what? It could protect the immune system of a person who is having HIV virus. So this is the use of this treatment. Okay, because if those people that is being affected by HIV, if they are not going to have this treatment or this therapy, it could lead to AIDS, and it's very, very dangerous for them. Okay, so next, how does it spread? Okay, how does it spread. So how people acquired AIDS or HIV? Okay, number one, we have contaminated blood transfusion. So meaning, contaminated meaning that blood is having virus. Example, if I am a person and I need blood because I am in the hospital and I need blood, and the blood that I receive is having virus, it is contaminated, meaning I will be also having the same virus because I am receiving blood coming from an infected person. Okay, so this is an example. A person is receiving blood. Okay, next we have hypodermic needles. Okay, hypodermic needles. Okay, what is this hypodermic needles? Okay, this is an example of hypodermic needles. Example again, contaminated. If this one is used by a person that is infected by that virus, and I'm using also the same needles, of course, I will be also affected. The same with that person. Okay, so we have to avoid reusing of this. Actually, this one is once you use this one, you have to dispose, you have to throw. It could not be reused again. Okay. So next we have pregnant women with HIV. Okay, pregnant. So of course, if you are a girl, if you are a woman, and you are pregnant, you have baby inside, the baby will be affected. Because why? The baby is receiving the same blood with the mother. Okay? So the baby will also get HIV. Okay, next we have, this one is an example of a pregnant women. Next we have breastfeeding mother with HIV. Okay, those mother that is having a breastfeeding, the milk. Okay, so what is this breastfeeding? Okay, this is a example of a breastfeeding. Okay, so if the mother is having HIV and the baby is taking the milk coming from the body of the mother, of course, what will happen to the baby again? The baby will be what? Become infected. Okay, so let's move. Unprotected sex. Okay, so this is very common case. Okay, very common case of transmission of or transmitting HIV. Okay, next, what should we look for? So what happened or what are the symptoms if a person is having HIV or AIDS? Okay, prolonged fever. When we say prolonged, meaning it takes a long time, not only one day, not only 2 days, but for a very long time. That's why it's called prolonged fever. Okay. Next we have unintended weight loss. Unintended weight loss. Okay. So you will be surprised even though you are eating a lot of food, and yet you are what? Your weight loss is decreasing. Okay? So because why? Because of the appearance or because of the presence of virus that is destroying our immune system or our cells. Okay? Next we have sweats, particularly at night. Sweats, particularly at night. So a person is sweating during night time. So you are going to wonder why I am sweating, although it is very cold because it's night time, but they are sweating or they are having sweats. Okay. So next we have Body weakness. Okay? Body weakness. Because why? Why there is body weakness? Because our immune system is mainly affected. Okay? So you don't have enough energy to do our activities. Next we have, let's move, swollen lymph nodes. This one. Get here on this part, we have our lymph nodes here. It what? Become bigger or swollen or inflamed. Okay, become bigger, big. Okay, this is what happened. Okay, so now let's move to prevention. So teacher, how are we going to prevent this kind of virus or this kind of disease? Okay, number one, safe sex. Okay, so safe sex, that is very, very important. You have the protection. Okay, next we have needle exchange program. So I told you a while ago about hypodermic needles. So that is not a reusable. So when we say needle exchange program, this is the use of clean, uncontaminated needles. Okay, this is the use of clean needles. Okay, next we have treating those infected. Of course, if there are people or there's a person is having HIV, you have to treat right away, or otherwise it could lead to AIDS. Okay? Of course, antiretroviral therapy or the antiretroviral treatment. Okay, this is very important so that viruses could be reduced in our body, or viruses could be prevented from transmitting to other person. Okay, and it will boost our immune system. Okay, so next disease, we have what we call malaria. Okay, malaria. Okay, so what is this malaria? Okay. Malaria is a disease caused by a mosquito. A disease caused by a mosquito. So this is not just the typical or the normal mosquito, because this type of mosquito is quite different. It is very dangerous. If we are not going to treat this one, it is very dangerous. Okay, so this mosquito we call female Anopheles mosquito. Again, female. Okay, do not forget that one. A female Anopheles mosquito carried the disease. So what happened here? If the mosquito will bite you or bite us, there will be what? There will be eggs. There will be parasites that will enter our body. Eggs or parasites that will enter our body. And what happened? These eggs, these parasites, they will attack our liver. Okay, they will attack our liver as well as our red blood cells or RBC. And they are going to reproduce inside our body. They are going to multiply. Okay? So here, if you are suspected that you are having malaria, you need to have blood test to find out. Okay? What is the use of blood test? Okay, your blood will be checked so that we will find out, or they will find out, what type of malaria, because malaria, it has many types, so they need to do blood tests to identify what type of malaria. Okay, so let's move. High risk. Okay, when we say high risk, these are the places that is having high cases of malaria. Okay, so which part of Thailand? Western, northern, and eastern border of Thailand. Okay, this could be the places like Thailand, Cambodia border, Thailand, Myanmar border. Okay, those places, those are mountainous, or they're having forest, and of course the presence of rain. Okay, the presence of rain. So if we have this type of areas, okay, rainforest, so expect that there will be what? There will be a high risk of malaria. Okay, so let's move. So what should we look for if a person is having malaria? Okay, so what are the symptoms? Okay, severe fever. When we say severe, severe meaning a very high fever, okay, above the normal body temperature. Okay, so severe, and it will take not only 1 day or 2 days. Okay, it is a prolonged fever. Okay, next, headache. Okay, you will be having headache. Okay, next, nausea and diarrhea. Okay, when we say nausea, it's like the feeling like you are going to throw up your food that you are eaten. Okay, you like to vomit. Okay, and diarrhea. Diarrhea is what we call also loose bowel movement. So there will be irregularity. Okay, you will need to go to the toilet every now and then, and which is also not good because you are going to suffer from dehydration if you are going to have this diarrhea. Okay, so how are we going to prevent this malaria? Okay, so how are we going to stop so that we are not going to acquire this disease? Okay, so we should have what? A mosquito repellent. Okay, a mosquito repellent. Okay, you can buy this one in a pharmacy, or you can buy this one in the drugstore. Okay, this is a form of a liquid, and you need to spray. Okay, spray to the parts of your body that is not covered. Example, this part. Okay, this part, or if you are wearing short, okay, you need to spray this, also this lower part. Okay, so this is in a form of liquid and spray. Okay, okay, and we have also drugs. Okay, malaria blocking drug. Okay, or malaria blocking drugs. So this drugs is to prevent. Okay, if the parasite well enters our body, this will block. Okay, from the word blocking, block the parasite. Okay, it will block the parasite from producing or from multiplying. Okay, and it and later and sooner they are going to what? They are going to kill the parasites. Okay, so next we have dengue fever. Okay, dengue fever. Okay, another disease that is caused by mosquito. Okay, so or another term for this one is dengue hemorrhagic fever. Okay, a dengue hemorrhagic fever. Okay, it is a disease caused by a mosquito virus. Okay, this time it is a virus carried by a mosquito. Okay, so what type of mosquito. So again, this is not the same type with mosquito that cause malaria. This is not the mosquito, the typical or the normal mosquito. This is another mosquito that is very dangerous. Okay, what is the name? The name is Aedes aegypti. Okay, this is the scientific name of the mosquito. An Aedes aegypti mosquito. Okay, so this Aedes aegypti, this is the carrier of the virus. Okay, breakbone fever. Okay, breakbone fever is another term for dengue fever. Why this one? Breakbone. Because usually, student, okay, usually the common signs or common symptoms if you have a dengue fever is the what? Joint pains, the bones, the muscles, and our joints. This one, okay. If you are if you are suffering from a dengue, this will be in pain, all the joint and our muscles. That's why it's called the breakbone fever. Okay. Next, what should we look for? So, what will happen to a person if she or he is having a dengue fever? Okay, of course, fever, severe fever. Okay, just like in malaria, person that is having a dengue is also suffering from fever. Okay, next we have headache located behind the eyes. Okay, it is this part. Okay, they are suffering pain. Okay, oh, this one, muscles and joint pain. Okay, all joints. Okay, all the joints and muscles. Okay, so people will again experience this type of pain. That is why it's called breakbone fever. Okay. Okay, next, skin rashes. Okay, there will be skin rashes or red spots in our skin if we are having dengue. Okay, so how are we going to prevent this dengue? Okay, prevention is get rid of mosquito habitats. Okay, so at home, if you have this type of habitat, okay, or you have let's say steady or stagnant water, okay, that stagnant water, mosquito could what? Mosquito could live there, and they are going to what? They are going to multiply. They can lay eggs. Okay, so what you are going to do if you have like this at home, so throw away or never ever stop water at home. Okay, never ever stop water at home. That is not covered. If you are going to stop water at home, you need to put covered. Okay, so that the mosquito cannot go inside and cannot lay their eggs because mosquito lay their eggs in the water. And we have International Anti-Dengue Day. Okay, this is celebrated every June 15. And what is the purpose of this one? Okay, the purpose of this one is to give public awareness because there are people that they do not know about what is a dengue fever. So the purpose of this one is to educate people so that they will know what is all about this disease, how dangerous this disease. Okay, so that's all for today, student. I hope you learn from this video. Okay, so about the diseases. Okay, we know the symptoms and we should also know the prevention so that we will not acquire these diseases. So that's it. And thank you for watching and see you again next time.